Welcome back to the show, folks. My next guest, I have to get this right, is the folks from it'd be Creekside Hospice. And I have Mr. Lowell Carlson, and I also have Mr. Kelvin Satcher. Did I say that correctly?
You did. Yes,
Yeah,
you did.
sometimes, being that I am advanced up in,
Linguistics.
yeah,
We get that.
Yeah, and all that kind of stuff,
You did great, though.
Right. Tell me something about Creekside's hospice, and how long are you just coming here, and what?
Yeah, we're just moving into the neighborhood here.
Okay.
We've been in Vegas for over 12 years successfully, and we've had a lot of calls to expand into this area. We've had clients request our services, but if you're not licensed and you're not privileged by Nye County, you can't just open up a business here. So we've gone through the pains to do all that. We're very excited about coming out here. We have a lot of interest generated from local physicians, healthcare partners, and some other people in the neighborhood here. And we're going to be at 2200 East Calvada, right next door to the Senior Dimensions office. Summit, or I guess it's
Southwest
Southwest
Medical. So, which is really a good location for us, and there's other healthcare partners, people on that avenue or street as well. We've been trying to reach out here for a little while. We are going to be opening our inpatient unit in Las Vegas next to San Martin Hospital. So it's just over the hill and off of Durango and Warm Springs. We're going to have a 13-bed inpatient unit there. So it'll be a little bit closer for people from Pahrump if they're using our services there. We are going to contract, hopefully, with some people here in Pahrump to do inpatient beds here. And when I mean inpatient, that's generally for people who are having some sort of issue that's not easily managed as far as their health is concerned. In hospice, our focus is going to be on trying to keep people as comfortable as possible in the last few months or several months of their life. A lot of people, unfortunately, think that they hear the hospice word and they immediately think of death, and which is, I guess, normal, but I keep telling people there's no D in hospice. Our H stands for help. It's for people who have at some point reached a decision not to have further treatment and or have gotten so progressed in their illnesses that they no longer can survive. And the options of surviving and getting the treatments are worse than actually just not doing anything. And we actually have documentation from Nevada, or from the National Hospice and Palliative Care Association, that says that people can actually live a little bit longer and have a better quality of life with hospice versus some of the aggressive things that we in medicine do.
Right.
I've been a nurse for 32 years. I've only worked in hospice 12. I had a very dear friend die of lymphoma, literally in my arms, because his family could not stop doing things to him. He was in a coma, and he had gone from Pat Boonish kind of guy and very charismatic to somebody who couldn't even respond.
Wow.
And it was pretty tragic, and that's when I kind of flipped the switch in my mind about hospice and became a very vocal advocate for that type of thing. We are going to have a job fair down here on Calvada coming up real soon. We're going to be hiring people locally on the spot at that job fair. We already have a social worker who's worked out here previously, and we have a clinical care manager, and she lives here as well, and she's an RN, and she worked for another hospice, but we were lucky enough to get her. Her name is Miss Cretney. Her first name is Joanne. Her husband works out here somewhere, I'm not sure where. And then two of our nursing assistants for Pahrump were orienting this morning. Yay. We're happy to have them.
Yes.
Well, you need the nursing assistants. That's kind of a backbone of hospice, is those people who do that nice, touchy-feely kind of care.
Yeah. Well, that's what I was going to ask Mr. Satcher about that. What do you do? What do you do as far as the nurse assistant? What is it?
Well, basically, with the nursing assistant, they do pretty much all the care for the patient, for making sure they get the appropriate bath, make sure they're getting them up, the care that they would need to give them a better quality of life. And like Lois said, we are going to do a big health fair here this Thursday from 12 to 9 that night at the Nugget. And basically we will be interviewing that day. So we're encouraging everyone to come out. We're looking for more nurses, CNAs, chaplains, social workers,
Volunteers.
Volunteers.
Name
I'm a chaplain with the Marine Corps League. You know, I mean,
We have a big presence with the VA in
Yes.
Vegas.
You do? Oh, great.
yes.
I guess the other thing I want to ask you, see here, you're talking about the insurances that, that you
Right.
accept.
Well, it's really interesting. I know that there are a lot of HMO Medicare-aged patient or people in this district or in this town. And a lot of times people think because they have an HMO, because they're so used to getting those referrals from their doctors, that they have to go through that system. Under the Medicare regulations, federal regulations, if you're on a Medicare HMO, you can choose any hospice. They do not have to be related to that HMO. And a lot of people, unfortunately, don't know that. So we can take Senior Dimensions, we can take Humana, United Healthcare, CareMore, which is a new company that just moved into Las Vegas. I don't know if they made it out here yet, but they probably will. They're expanding. But people always have a choice. And that's the most important thing that we try to get across to people is get informed, get the information as fast as you can so that you can get some help. And I tell people in my speaking to them, just getting the consult for hospice doesn't mean you have to have hospice.
Right.
But if you get it, then you already have an idea of what it's about and how it's utilized, and getting the information up front makes it easier for you to make a transition to hospice at some other point. Or not. My goodness. Is my time up?
Yeah, no.
Anyway, it's a very rewarding field. And we are looking for our volunteers out here.
and so forth, yeah.
We really, really are. And Barbara Colvin at our mainline number, 650-7669, is our volunteer director. And she'd be happy to talk to anybody about that.
Now, you said that you have inpatient
Yes.
facility.
Right.
That's an inpatient, so that means that anyone who needs hospice can.
It actually, there are 4 levels of care in hospice. There's
Yeah.
routine care where the person's taken care of at their home or wherever they live. Could be a group home or assisted living. There's a thing called respite care. So if a person's caring for someone and they are just getting tired from trying to manage all
I
that,
got
they
you.
can get a break, and where hospice will pay for room and board somewhere, either in their own facility or in a nursing facility where we're contracted with, to give that person a 5-day time span to get themselves organized. And then there is continuous care, which is for people who you probably recognize this statement. I'm never going back to the hospital again
Right.
for anything. But their symptoms are so bad, we can't really manage them very well at home. So we can do continuous care. Basically, that's up to like 8 hours of intensive care
Intensive
in the
care.
home to try and get the symptom, whatever's out of control, managed. Where we also have the inpatient level of care for crisis management, but that's only usually very short term. It's not you're not going to go in there and live there. We're going to
Right.
get you controlled
Try to
and back to where you need to be, at home,
Right.
which
Now-
is where everybody wants to be.
Right. Now, in your open house, you're going to cover things that people need to know about hospice. I
Most
understand.
definitely. Right now, the date has not been scheduled, but we will be having an open house here, and we will be inviting the whole community as well as the different professionals out for a ribbon cutting. So again, it's going to be a grand opening, and we just want people to know we are in the area and we're here to take care of their needs.
Oh, so the open house. So with the open house, I understand that's coming this Thursday.
Right.
Yes.
This
No,
Thursday.
that's actually
That's
the
the job fair.
fair.
The job fair is Thursday.
Job fair is Thursday.
Yes, so we-
We're expecting the open house to happen sometime in March.
Yes.
Ah, I got you.
Yeah,
Okay, see,
because
I'm thinking, doing.
We're in the middle of building out. It's not as easy as just getting a
Yeah.
license. And
Oh,
opening
I
the
got
door.
you.
Yeah, there's a lot more to
And
it.
then we want to make sure we have the staff
Right, the
available.
staff
So
is
that's why we're
everything
doing a
first.
job fair
Most important.
Thursday, and
Right.
once the staff is hired on, then the staff
you'll
will be
do
able
it.
to meet the
Yeah.
community.
What telephone? Can they a telephone number that they can call
Yes, they
to
can.
talk to you?
They can call 775-727-7000.
775-727-7000.
Yes.
That's it. And for any information that they need to know, you can give it to the folks out here. I think that's good. That this is a sort of a senior area here, and so I think that's a good idea. You guys coming here, and I appreciate you coming.
Appreciate you
And,
allowing us to come on your show.
and giving us this information.
Al,
And so,
thanks so much.
likewise, I look forward to seeing you at the open house.
All right, yeah, I'll be
All
here.
right. Stay tuned, folks. We shall return after these messages. I'll be okay. I don't know when.
That's great.